We want to use that to dovetail into Dr. Ellerin. We're joined now by Dr. Todd Ellerin, the Director of Infectious Diseases at South Shore Health, to talk about COVID-19, what the Vice President was just talking about. So, Doc, it's great to see you as always. Hi, how are you? Massachusetts health officials are tweaking the state's quarantine guidance, allowing people exposed to COVID-19 to leave quarantine as early as 10 days if they test negative beforehand. So a simple question, is that safe?
Yeah, I'm glad you brought this up, Ed. I think it's important. What you need to know is that most patients, over 90%, maybe close to 95%, who develop those symptoms by day 10. So I think what the Massachusetts Department of Public Health is trying to do is they're trying to say, we want patients to quarantine. It's as important as ever if you're exposed to a positive patient. But we also want patients to actually do the quarantine. So instead of 14 days, which seems pretty onerous and difficult to accomplish, by decreasing that to 10 days, that hopefully more patients will stay in quarantine. Now, this is important. The only way you get out of quarantine at 10 days is if you have no symptoms and you've tested negative by a PCR on days 8, 9, or 10. Does that make sense? So you can't just stop at day 10. You have to test negative before day 10.
So you have to test negative through your doctor 10 days after the first test.
You can get that test at day 8 in the thinking that a lot of these tests take about 48 hours to come back.
All right, so let's talk about the more vaccine news. And we just heard the Vice President talking about Operation Warp Speed. AstraZeneca saying its vaccine is showing success in immunizing older adults. Their study finding that nearly the same immune response in people over the age of 70 that it has with teenagers and middle-aged people. So is that different from Pfizer and Moderna? And why is that important?
So first of all, this is very important, very encouraging on the vaccine front for AstraZeneca and Oxford team. Remember, this is phase 2 data, so it's your immune system's response. They haven't released the effectiveness, how effective is their vaccine. But what they showed is that their vaccine gives the same type of immune boost to the older patients over 70 as it does to the younger patients. So because we think those scientists have found the right target, it makes one think that their phase 3 effectiveness data is going to be very successful as well, although that remains to be seen.
Yeah, but that if that progression continues, that could be 3 bites at the apple and 3 high success rates. No, I mean, it's that in itself is very encouraging, right?
Absolutely.
All right, so the U.S., and here's the sad part. The U.S. has passed over 250,000 deaths. The rate right now is 1 COVID-related death every minute, which is startling, shocking, and horribly sad. In Massachusetts, we just hit what equates to 2 deaths every hour. So where does COVID fall compared to, for example, the flu or heart disease or car crashes?
All right, so in America, heart disease is the leading cause of death, over 600,000 cases per year. Number 2 is cancer, just under 600,000. So there have been over 250,000 deaths for COVID-19, so it ranks 3rd. But when you look at nearly 2,000 deaths a day, if COVID-19 continues at that rate, it would overtake both heart disease and cancer as the #1 leading killer.
Wow, that's a sobering stat.
It is. Really. It is. Very quickly, Dr. Ellerin, before you go, CDC right now saying people should not travel for Thanksgiving. What are you doing personally for Thanksgiving?
This is so sad because Thanksgiving obviously is the holiday for families to come together, but I agree with the recommendations that we're hearing that families should continue with their own bubble. I canceled my Thanksgiving plans and am going to be doing it with my bubble as well. So I think we have to keep the numbers down. It's really hard, but remember something. If we have Thanksgiving as business as usual, then you need to look long and hard at the people around the table because you may not see some of them come Christmas time.
Wow. Dr. Ellerin, thank you so much for sharing your thoughts, your insights, your expertise as always. Great.